The fact that pressure increases underwater affects us in several ways. In this section, we discuss increasing pressure on descent, the equalization process, air spaces during ascent, and diving with cold or congestion. Our bodies contain several air spaces, including the lungs, middle ears, sinuses, and the passageways that connect them. As long as these passageways are healthy and open, the pressure inside these air spaces will equalize automatically during descent. The exceptions are the middle ear spaces. The middle ears connect to the backs of our throats via the eustachian tubes. These tubes are not sealed, but they are normally closed. To allow the pressure in our middle ears to increase in direct proportion to the pressure in our other body air spaces and the water surrounding us, we must equalize this pressure manually. We can do so using any of a variety of methods. The most common method is the Valsalva maneuver. To do this, you simply pinch off your nose, block your regulator mouthpiece, and blow gently. As the air cannot escape through your nose or mouth, the only place left for it to travel is up your eustachian tubes to your middle ears. Some divers can also equalize simply by yawning, swallowing, or wiggling their jaws from side to side. The key to equalization is to do it early and often. Begin at the surface, pinch your nose, block your mouth, and blow gently. The sensation you should feel inside your ears will confirm you are able to equalize and should be able to do so as you descend. With practice, you will get a feel for how often you must equalize as you descend. To start, equalize at least once for every meter or 3 feet of descent. More importantly, you should never go deeper than you can comfortably equalize. If you reach a point in your descent where you can no longer comfortably equalize, stop. Ascend a short distance, then attempt equalizing again. If successful, continue your descent, equalizing more frequently as you do. If you cannot equalize successfully in shallower water, continue ascending until you reach depth at which you can equalize successfully. Only then should you start back down again. Do not attempt to equalize by exhaling forcefully. You could damage your ears. It is important to understand that failure to equalize correctly can cause permanent ear damage, resulting in loss of hearing and/or balance. As you ascend, the gas inside your body's air spaces will expand. As long as your air passageways are normal, healthy, and uncongested, air spaces such as your lungs and sinuses will vent this expanding gas automatically each time you exhale. Even your middle ear spaces will generally depressurize by themselves. Problems can arise, however, if you attempt to dive with a cold or congestion. Doing so may cause you to experience a reverse block, a situation in which expanding gas cannot escape the ears or sinuses. If you experience a reverse block, stop. Continuing to ascend will only make matters worse. Descend to a point at which the pain or discomfort subsides. Wait here for several minutes to give the expanding gas the opportunity to escape. Yawning, swallowing, or wiggling your jaw may allow gas trapped in the middle ears to escape. Resume your ascent. Ascend slowly and stop frequently to ensure expanding gas has the opportunity to work its way out. Repeat this process as needed. Do so until you can reach the surface without pain or discomfort. Reverse blocks are rare, but sooner or later, most divers experience one. They are yet another reason it is important to keep plenty of breathing gas and time in reserve to deal with potential problems. Some divers take over-the-counter decongestants or other medications in an effort to make equalization easier. Bad idea. Decongestants can wear off underwater, leading to a reverse block on ascent. Any drug can have unforeseen side effects under pressure. Do not take over-the-counter medications when diving. If you are on any prescription medication, ask your doctor if it is safe to use under pressure. You should only dive when healthy and uncongested. Attempting to dive with a cold or congestion is just plain foolish. Occasionally, air rushing out from inside the middle will cause the inner air mechanism to cool, resulting in momentary vertigo. If this happens, stop. Find something to hold on to, such as a rock, ascent line, or your buddy. If it helps to do so, close your eyes. The feeling will generally pass and you can continue your ascent. If it does not, have your buddy help you to the surface. Seek medical help if the situation does not improve.